is James Pappas, MD. I came into practice of otolaryngology, ear, nose, and throat medicine in 1963. At that time, I got on the medical staff of Baptist Health. At that time, it was just known as the Baptist Hospital. Now it's Baptist Health and Baptist Health Little Rock. Principles were the same. The operating rooms were much smaller because we didn't have all the technology that we have now. We didn't have all the visual audio and visual cameras in the operating room, and we didn't have the electronics that we have now. There's basically an operating room table and the cabinets in the side of the room with the various instruments that the doctors needed, and supplies, of course, that the nurses needed, the drapes and the pillows and things for the anesthesiologist. And there was just about enough room just to move around with the surgeon and the assistant surgeon and the scrub nurse and the circulating nurse and the anesthesiologist, and that pretty much filled up the room in those days. And we had, at the old hospital, as I remember, at least 10 or 12 operating rooms and a very nice doctor's lounge where we could go relax between cases while the room was being prepared for the next case if we had more than one case that day. We on the medical staff are blessed to have the administrators we have. They have a feel, as you know, and many people know, this hospital still maintains its religious connotation. Baptist Health is from the faith, from the Holy Bible and the Christian faith, and we administrators are cognizant of that, and everything they do is geared to healing the patient, not only medically and through nursing care, but spiritually and psychologically. And I think the administrators we've had, one after the other, have all had that feeling of their mission, as we call it. And the patients who come here are really blessed because just about everyone, if not everyone, has that attitude of a Christian mission, faith, to help the patient get well quickly. And you see it every day in this hospital at work. But we all went into medicine for the right reason, or most of us did, and that was to take care of patients, have the empathy and care of making people feel better. If we couldn't cure them, at least we tried to relieve their pain and their difficulty and their suffering. And I think most physicians that I know are in medicine for that reason, no other reason than that. And so to supply a little free care once in a while was no big deal.